All right, so we got a smile on our face, so that's always a plus. All right, so let's stand right over here. Hold on. And if I were to ask you, if you could just, one of you guys stand behind him just to make sure. And all right. And if I could just ask you just to say, can we squat down at all? And just could you squat down just to see if we can make any kind of range of motion there? To see if we can move. Just see if we can move. Okay, just squat down for me. Mm-hmm. Now I want you to tell me in your own words, what do you think about that? Because you could not even move before, and you could almost squat down and touch the floor, and that was one treatment, right?
One treatment.
Okay. How'd that make you feel?
Yeah, great. Like hugging you.
I'll hug you in just a second. Now, and patient, and you've had a knee replacement.
Yes, sir.
Came in here in a brace. This was one treatment, and I tell patients all the time, if I can help you with knee pain, you're going to know in 2 treatments, and you knew in 1 treatment, right?
Yes.
All right.